Good morning, everybody, on this Monday morning across the Murrumbidgee Local Health District. And I guess an important day for New South Wales, and it's extraordinary to think that New South Wales now has 80% of their population fully vaccinated, which is a really outstanding result from the citizens of our region and across New South Wales. The results are not quite as strong in our region, and we still have a way to go, and I'm going to talk a little bit about that today and what that means for us. At the moment, we are managing a significant outbreak along the border region, and I want to say to people who are living in that region that we're really ramping up our management plan. We've got tested plans and processes in place to make sure that we are able to live and manage with COVID. This is going to be the way that we're probably going to live going forward, as restrictions from both sides of that border area are starting to lift. We heard over the weekend about changes happening in the Victorian system and of course in New South Wales. So living with COVID is something that we all need to understand and what we can do to help in that process. So we're really urging people who are in that border region, particularly in the Greater Hume and Albury area, today to please just be cautious and pause plans if you're thinking of moving around and out of the region. This is, I think, how we all need to work now as citizens. If we have an outbreak in our town or community, it is only sensible that we continue to follow those COVID safety measures that we're all so well versed in now, but also just plan any non-essential travel around or out of the community to help keep your community safe. So just in terms of numbers, so we've got 18 new cases today. 9 of them are in that Albury LGA, but then 6 of them are in the neighbouring LGA as well, giving 15 cases there just in a day. And look, we are going to see more cases. There will be close contacts of people and families. Majority of our cases actually are relatively young people and children, so we need to be very cognizant of the fact that we're going to need to be cautious over the next week or so. There's also 2 in the Murray River and 1 in the Edward River. So we're starting to see that outbreak that was in the Edward River really now slowing down significantly. We have had now 105 cases associated with this current wave. So testing is really important. I wanted to talk today about what we can do to keep ourselves safe, and testing and vaccination is what I'm going to touch on. So just to give you an idea, people are doing the right thing. Over the weekend, we actually had 3,260 people, which is an extraordinary result on Saturday and Sunday of people who have come forward, and we thank absolutely everybody for that work. Albury tested over 1,070 people at a number of testing stations there, and we are seeing today quite significant demands for testing in the Albury LGA. We ask everybody please to be patient. We've got quite a lot of young people coming forward for testing today, so please be respectful of the staff who are working there. There is additional testing capacity being opened up this afternoon, and we're also sending more staff into the Murrumbidgee testing centre there as well. So we're really ramping it up, and we're working with our testing providers in the region, and they're extending their hours, which is really terrific. In Wagga, we did nearly 2,000 tests over the weekend, and Deniliquin also, that community continuing to be really responsive with their testing rates at 228, so good results. So let's just talk vaccination now, because for the Albury region, this is one of the most critical things people can do to help slow the transmission. As well as restricting your movements and being cautious with your plans, we're asking you to please complete your vaccination. There's a pleasing result there for first vaccinations at 89.8%, but the fully vaccinated rate at 61.4% is significant below that 80% that we know is the safety margin that will help keep communities safe. Please do not consider bringing forward your second dose earlier than the interval it is recommended in accordance with the vaccine you provide. If you do, there are 2 things that will happen. 1, you won't get such a good result and your protection will not be as strong. And secondly, you may not be able to print out your COVID digital certificate, which will mean it'll be difficult for you getting into venues. So please wait the recommended interval, particularly if you're having Pfizer as a majority of the population, it is only a 3-week interval between doses. And we have brought forward the interval with the AstraZeneca vaccine now to be between 4 and 8 weeks when there's an outbreak. So we can manage that well. Monday to Sunday last year, Murrumbidgee Local Health District delivered 3,274 vaccines, and of course our pharmacists and GPs are also vaccinating and going really hell for leather. This week, where we are identifying gaps, we're doing our pop-up clinics, which are no bookings, no Medicare card if you don't have one, but bring one if you do. So we're in Tumbarumba today. We're in Coringal, in Wagga Wagga on Tuesday. We're in Narandra on Wednesday, and we are all week in Tolland, working there with the local community in the community centre. Wonderful first dose vaccination rates in Murrumbidgee, 91.3%. Absolutely worth celebrating. And last week we passed our 50,000th vaccine that Murrumbidgee staff have given. We've now delivered 53,350 vaccines. So all is going well, but we've really got to get our second dose rate up to really slow any transmission of disease. Last thing I wanted just to mention was exposure sites. New South Wales Health has a new way now of notifying exposure sites. Once the contact tracers enter their data into the system, it goes straight into a website, and people are able to then also look on their COVID app through Service New South Wales, which really negates that need to go through long lists of venues and trying to find where you might have been. So that's a really important change that just means that we can get those exposure sites identified much earlier for people. I'm going to hand over now to Professor Len Bruce because I want him to talk a little bit about living with COVID as we move forward over the next few weeks and a little bit about the particular COVID virus. So Professor Bruce, thank you.
Thank you, Jill. It's interesting, after we've spent 18 months essentially counting cases, that we are going to have to move past that now. Living with COVID means that there will be COVID cases in the community, but our responsibility is to look after our community. In other words, prevent people from becoming severely unwell and needing hospitalisation, and obviously also patients passing away. And the great news is we have very effective tools for that. Vaccination is obviously the best tool for us to manage COVID and for us to progress through the pandemic into what a post-COVID world will be. There is no question that vaccines are effective. Sadly, there's lots of misinformation going around, and the facts are as follows. If you're fully vaccinated, your risk of being hospitalised with COVID is 4 in 100,000. Now, obviously, for younger people, that risk may be even lower, and for patients that are a little bit older with chronic disease, but really 4 in 100,000. So it means that in the Murrumbidgee, if we can vaccinate 200,000 of our population, we'll only have 8 people in hospital, which is about a third of the capacity of the COVID ward. Obviously, it's very sad for us when people pass away from COVID. Your chances of dying from COVID if you're fully vaccinated is 1 in 100,000. Clearly, vaccines are effective. So it's important that if you've not been vaccinated, please go out and get your vaccine. The other caveat to that is you need to be fully vaccinated. And the vaccines that we have available in Australia require 2 doses, and we expect that you're fully vaccinated 2 weeks after your second dose. Really, really important. I know there is some concern about booster doses. ATAGI has released guidelines in terms of patients that require a 3rd dose, and that's a very small group of the population. It's normally people that have chronic diseases where they have less of an immune response and they may need that 3rd dose. But for the majority of the population, we will continue to be protected, after 6 months. And once again, we are looking at whether or not there should be 3rd doses for other groups in the population, and we'll work towards that and follow the guidelines. In terms of testing, it's absolutely essential that if you have the mildest of symptoms, please go and get a test. And the reason for that is twofold. Firstly, if we know you've got COVID, we can look after you. If you're unable to isolate safely at home, we have accommodation options for you that we can keep you safe and your family safe. But the other important component of that is treatment. We actually now have effective treatments to support people who are not vaccinated, or even groups that are vaccinated that are at risk of severe illness. But we need to diagnose the disease early. It's the same as the treatment for influenza, where it has to be administered early in the disease process. So please don't wait, being unwell for a week and then go and have a test. It really is important that you get tested early so that we can look after you and provide you the best possible care. It's great not being in lockdown anymore, but we should not forget all those things that kept us safe for the last 18 months. If you're symptomatic, go and get a test and stay at home until you've got your result back, and also until your symptoms have resolved. Because everybody's concerned about COVID, but there is a multitude of other viruses that can cause significant impact in the community, or if you go to work or to school, where you're going to infect a number of your co-workers, and now they have to go and get a COVID test and isolate until they get the results when they're unwell. So please, do the sensible things. Wear your mask. And mask wearing is probably not going to be mandatory for much longer, but we know it works. And my kids ask me, am I going to continue to wear my mask? And I'm so used to it now, wearing it when I go to the shops, I'll just continue doing it. So it really is important that we keep doing all those things that have kept us safe over the last 18 months. But it's great, 90% vaccination, and it means in a few weeks' time, the fully vaccinated rates will be more than 90%. And it's going to be a completely different world, and we'll be able to move on and continue with business as usual in the healthcare service. We have patients requiring elective surgery, patients that prevent with other conditions, and we want to move forward to continue to serve the community as we've done. Right, any questions?
Obviously, restrictions have eased today in terms of capacities for hairdressers, salons, and all those sort of stuff. How confident are you that we will get through this? You want us to live with COVID, right?
That's correct. I've been out and about over the weekend, and all the venues that I visited have been absolutely magnificent. They made sure that I checked in. They checked my COVID vaccination certificate, which is really great. To put it into perspective, the chances of transmitting COVID if you're fully vaccinated is reduced by 50%. And your chances of being infected with COVID if you're fully vaccinated is also reduced by 50%. So all the businesses that I've seen are doing the right thing, and the community at large is still doing the right thing, and we just need to continue until we can get our vaccination rate as high as we possibly can. And I think we can get to 95% in the Murrumbidgee personally. Why settle at 80 if you can get 95? Because the more people that are vaccinated, the less virus we'll have in the community, the less chances for variants to develop. So really, it really is a no-brainer to get vaccinated.
You're having some outbreaks along those border regions, as you were saying. When are we expecting to see cases rise for the greater district? Obviously, a lot of people travel from Albury to Wagga a lot. When are we expecting to see numbers rising around the rest of the district?
We're obviously always concerned for those first 2 weeks after an outbreak, but once again, we're expecting to see cases. So there is not anxiety about having a case in Wagga, and we've had exposures in Wagga, and we've had cases in Wagga. There's no need for us to be anxious about it. It is going to happen, but if you're vaccinated, you're well protected. And if you become unwell, we have more than enough capacity in our hospital to look after you. We have more than enough intensive care beds. If you're unlucky enough to require an intensive care bed, we have more than enough medical staff. So we are very confident that we can manage the cases as they arrive.
And a significant percentage of these new cases are in Albury and the areas around Albury.
Mm-hmm.
Has the MLHD given advice to the government that Albury should be put into lockdown? And if that's not the case, why not?
I'm happy to take that one. So I think now we're in part of the roadmap and recovery out of COVID. The message that we have today for the people, particularly in the Albury and Greater Hume LGAs, are about people doing the right thing and restricting their movements. So obviously the governments will continue to keep a very close eye on what's happening, but we haven't had any major exposures in the Albury LGA, and I'm sure the citizens there will heed to the advice and keep their community safe.
Jill, are you concerned about the number of unlinked cases in Albury?
I'll take off my mask and you can hear me better. Look, as we start to get larger numbers of exposures, there are about half of them that are linked and close contacts of existing cases. And then we get, as we get more community transmission, we get a greater number. And we're going through that interview process at the moment and working back and tracking back with people to see where we can link the cases. So I'd probably say to you it's early days and it does take us a while, and probably as people remember information for us to be able to link those through. But look, the higher number of cases you get when people have been out and about in the community, and there is exposure sometimes that people are not aware of, which is why it is so important that we follow our check-in through our app, wash our hands, maintain that social distancing, because that's what's going to keep us safe.
Several schools around Albury, Lavington and Ginder have closed for cleaning as a result of the positive cases. What are the risk level and level of concern for school-aged children?
Yeah, so as we know, children under the age of 12 are not eligible for vaccination at this point in time, and I think across the world we're seeing a lot of work being done on getting vaccinations that are safe for the under 12s, which is really important. But, you know, kids travel together to schools on buses, and if you get a family contact who later tests positive, then you get a whole bus load, and that's just how you get the transmission. There's a really good process for managing school exposures, so the Department of Education and also for childhood early learning centres, that early childhood sector have got really experienced teams who work directly with the schools in going through identification of close contacts, and the schools themselves will then contact parents to give them instructions and advice around what to do. So that process is well underway with a number of schools in the border region.
So
Yeah. We've heard there's a four-week-old baby among the positive case in Albury. Can we have an update on the child's condition, and are they in hospital with their family or being cared for at home with their family?
So I'll have to take that one on notice because you'll appreciate with Albury Wodonga Health with the cases, the clinical care is actually provided by Albury Wodonga Health through Albury and Wodonga hospitals. So whilst we are managing the outbreak there and the public health side of it, Albury Wodonga Health actually manage the clinical care. So perhaps you might address that question through to them. Thank you.
There are reports as well that the Mercy Aged Care in Albury has locked down and that 2 residents have tested positive. Do you have any information on that?
So aged care centres are places, of course, that are very vulnerable when there is a COVID outbreak, and generally through exposure, again, if residents are out in the community or with their staff. So there's joint protocols in managing outbreaks in aged care facilities between the Commonwealth Government and the New South Wales State Government, and we are working with an aged care home in Albury, and they have really good COVID management plans, and we lean in and provide support, particularly around infection control, PPE, and making sure that they're receiving really good advice about the clinical care.
And could you break down the cases in the Albury LGA based on the exposure sites? For example, how many of the new cases are linked to the Z-bar exposure?
So that information we don't provide publicly because it's really important that we always protect the confidentiality of cases. So we won't break down by venues, no.
Jill, do you think the vaccination rate is high enough for us to be tackling an outbreak of this size in Albury?
Well, the fully vaccination rate at 61 point, just over that, percent does leave us, I guess, with a risk. So now's the time really, I think, we've seen across the state when people get an outbreak in their region, sometimes that's a wake-up call for people who've been a little bit hesitant and are waiting. That's a wake-up call now that we need to finish our vaccination program, or we need to come forward for our first vaccine. I think now we're really getting good at providing vaccines at a whole range of venues that suit different people, whether it's a pharmacist, your doctor, or one of our clinics where you can just walk in at a time that suits you, and particularly on weekends. So bringing the vaccine to the people is a really important part of just playing that catch-up game. And look, I think regional areas, because we lived for so long in relative, low numbers, people haven't felt that same degree of urgency to get their vaccine, and we watched from afar as Sydney went through some really significant issues in local communities. So I think we're seeing now those first vaccination rates at over 91%, that just shows people are going, yep, now it's time. And I think we've only got a few weeks now. Majority of those will come forward and have their second vaccine, and we'll find ourselves in a really good position. So I think we're able to cope with the outbreak that we have in Albury at the moment. We've got good management plans. We've got good testing capability. There's low rates of hospitalisation, and the majority of people who have COVID are being cared for in the hospital and the home.
Are you concerned at all with the restrictions being eased and more people out and about?
Look, people have largely been doing the right thing. And we do, again, just put a call out to people in that border region just to really limit your movements. Think twice if you're going to travel out of the region, and just stick to your essential movements as you're required.
You mentioned that nursing homes, Jill. Do we know if it's linked to a staff member or resident bringing COVID into the...
So we've only just got some information about that aged care facility, so we're just doing our investigations this morning, Simon, and we'll provide further information. That case actually is not in our numbers today, so we'll be providing further information. Yeah.
There's also been reports of a case in Tumbarumba today. Have you got any information about that?
So again, the cases that we report each day come in before 8 o'clock, and so we are getting cases coming in all the time, and as soon as we have information about a case, we'll certainly let people know.
And we saw a huge amount of testing done over the weekend in Albury. Are any other health districts and providers being called upon to support testing in the region, and what's being done to increase capacity?
So we, overall across our region, we did over 11,000 tests right across our region last week, just in 1 week, and that was a 5.8% increase in testing from the previous week. We work really closely with a number of pathology providers who help us to ramp up and down our testing capability, and so we've got a really 3 partners in Albury who can increase hours or set up drive-through testing clinics, which we're seeing established there today. So we've had great buy-in from a range of partners, and of course Albury-Wodonga Health who are working alongside us.
And Lavington Cricket Club had a positive case with a member who attended training twice last week. What can the other players and people that were at that training session, what should they be doing?
So information about either close contacts or casual contacts will be provided directly to people who are affected by our public health unit. So what people should do is, if they're concerned, get tested and stay home until they receive a negative result or further advice from our public health unit. Thank you.
Can I ask one more? The Harris Farm Markets seems to be an exposure site, but it's not listed anywhere. Is there a reason for that, or is there where people can find out more information?
So once again, we're going to, in the media release today, there is the link where you can get onto the New South Wales list of venues. But just remember that it depends what people did when they were actually in the venue, how long they were there for. If they dropped in and walked around and walked out in a very short time frame, under 15 minutes, then that won't go and be listed as a venue. So it all depends on the information that our contact tracers glean from the interviews. All right, thanks guys.
Thanks, Jill.
See what happens in the next few days.